This is Ashley Anderson. This is task 1, making some serum. So I have Bentley here, so I'm going to use a tourniquet here to kind of let the vessel pop out. Then I'm going to just clip a small area so that I can see the vessel just a little bit better. So you can see it right here. Then I'm going to spray it with alcohol. And I'm going to use a vacutainer. So this part connects to here. My tubes are right here. And I'm going to it's a little rolling. There we go. And we're going to fill the tubes up. So I have one serum here. And then there's 2 ml here of the EDTA. And the last bit of serum for the red top. And the serum here. So then we're gonna unleash the tourniquet and we're gonna hold off. And I'm going to, this one is already inverted. I'm gonna wait for these 2 to clot and then I'm going to spin them down. I've allowed these tubes to clot for about 20 minutes so you can see that they're clotted. This one's not gonna clot because it has the EDTA in it. So I'm going to remove the top carefully and I'm going to rim the tube here, and I'm going to rim this one, but I'm going to get a different pipette just so there's a bit contaminating. Here. Then I'm going to put it in the centrifuge. So I have my 3 tubes here, and then I have 3 tubes that are just filled with water just to balance it. So I'm going to put them in accordingly. And I'm going to spin these down. So hemolysis can happen when you get a bad blood draw, or if you put a needle into the vacutainer and push the plunger down. Essentially lyses the cells, which can alter the CBC because it can affect the platelet count, the hematocrit. It causes agglutination on the smear, so you don't get an accurate count. Lipemia is just a high fat content in the blood, so it's usually with patients who have high triglycerides and high cholesterol, and it can cause elevated GGT levels and hematocrit levels and platelet count.
Go.
Okay, so now my samples are done in the centrifuge. So what I'm going to do is I'm going to remove the plasma and then put them in 3 separate non-additive tubes, which are the white ones. So I have the 3 tubes and the 3 different pipettes for each tube. So I'm going to open the centrifuge here and so that's my controlled balance. So that one's that. Serum for this one. the serum's down here, and I'm going to pipette just the serum and leave the whole blood cells here. So there's the serum for that one.
Yes.
So blood cell serum. Sorry,
I don't think so. No. Okay, thanks. That's work. I call you right back.
So now this one is separated.
All right.
The last one, which is the serum separator one. Where?
Be nice to him.
Okay. And then that will go in this tube. So I harvested serum from all 3 tubes and all plain white tubes here. This is task 9, doing ACT test. So I have my dichotomous gray tube. I've warmed it for 3 minutes till it's got to 36 degrees Celsius. So I'm going to first do a venipuncture. So I'm going to do the saphenous here. So I'm going to spray it with alcohol. And then I'm going to use a vacuum cleaner. So I'm going to pull and fill 1 tube up, discard it, and then pull 2 mLs in the tube that I'm going to use for the test. So the first one going in, and I'm going to discard this one. Then I'm going to start timing for 30 seconds now while this tube fills up, and inverting it while I pull. And then now that I have at least 2 mLs, I'm going to pull out, and then she's going to hold it off. And I'm still counting for the 30 seconds while inverting. So 30 seconds, I don't have a clot yet, so I'm going to time it every 10 seconds. So at 10 seconds, I still don't have a clot. It's another 10 seconds. So now we've reached 1 minute. And I'm still going to keep checking until the clot forms. Another 10 seconds. Another 10. So this isn't actually a dichotomous gray tube, it's actually just a white top tube, so the clotting is going to take longer for it to clot, and so that's why it's longer. But if this was an actual dichotomous gray top tube, then it would be quicker. So now we're at 1 minute and 45 seconds. Minutes. 2 minutes, 10 seconds. So I'm checking it every 10 seconds. 2 minutes and 45 seconds. Minutes. So you can see right at 3 minutes and 5 seconds there's a clot, a tiny little clot forming. So once the clot forms, then I'm going to record it in the chart. So the chart's here, and I'm going to record the time of 3 minutes and 10 seconds. And that's it. This is Ashley Anderson, and this is task 11, doing a snap test on Eliza. So I have 4 drops of the blue already in the tube. So then I'm going to get the serum, which is right here, and then I'm going to add 3 drops of the serum to the blue. So there's an eyedropper here in the snap test. So we're testing for lepto. So I'm going to suck up here so I get 3 drops of the plasma. I'm going to invert it 10 times. I'm going to put the patient's name here, which is Tilly, and her last name is S-E-A-Y. Okay. Then I'm going to put it here in the window. And I'm going to insert into snap test. And it's going to process the sample. Just takes a minute. So the timer's set for about 10 minutes, and so once this test is done, we'll take it out, read the results, and then put it in the computer. Okay. So the snap test is finished, so you can see here that it's negative for lepto, and they save the results. So to put it in the computer for a chart, I go under her chart, activities, lab work, manually enter results. Then it's set on the doctor. Then I scroll down here for snap. Scroll down until I find lepto, which is right here, and then just put negative. And okay. Okay, and it's in there. This is Ashley Anderson, and this is task 12 for finding ear cytology. So I have my PPE on, which includes my gloves and my lab coat, and I have my patient here who's sedated. So the first thing I'm going to do is I'm going to pre-moisten these swabs with saline. Then I'm going to place the swab inside the ear canal and gently collect a representative sample. So very gently, just doing a circular motion. So you can see I have a sample on the swab. So then I'm going to take the sample on my Clin slide, and I'm going to rotate it down the slide like this on a nice streak. And I'm going to gently wave it in the air for it to dry. Okay. So I finished waving the slide in the air, so I'm going to take a lighter and go under in a slow motion to heat up the slide. And once I've done that, I'm going to go stain it. So we have two sets of stains here in ER. There's a dirty one and a clean one. Because it's ear, I'm going to do the dirty. So it's a dip quick. So I'm going to dip it 10 times in the fix. And then I'm going to do 10 times in the pink. And then in the purple 10 times. Okay, then I'm going to go over here to the sink and I'm going to take some distilled water and just gently rinse it off. Kind of let the stain go down. And I'm going to, this is the bottom of the slide, so just kind of take that off there and then wave it so that it dries. While I'm waiting for it to dry, the different types of organisms you can see on ear cytology is usually bacteria and yeast, and so there's two types of bacteria. So you have the cocci bacteria, which are going to be round bacteria, which you'll see here, they're the circles here. But then there's also rods that you can see, which are the rods right here. There's also, you can see yeast, which look like little footprints. And so you can kind of see them here. They look, some people say footprints, some people say little snowmen that you'll see there. So those are the main ones that you'll see. So now that my slide is dry, I'm going to start it off at the low power at 10 times. And turn this on. And I'm going to first focus it on the lower power here. And then once it's focused on the lower power, I'm going to go up to the 40 times and scan it like that. And then to the 100 times. And once I'm in the 100 times, I'm going to go in a fashion where I look at the entire slide, so it's going to be a pattern like this, so that I get every part of the slide. You can turn it off. Now that I've, so I looked at the entire slide in a pattern like this, so I got all the slide. The main microbe I saw were the yeast, which were the little footprints here. And so once I document that in the patient's chart, I inform the doctor. This is Ashley Anderson's Task 14 doing a skin scrape. So I'm going to place a drop of mineral oil on the microscope slide. And then I'm going to take a new scalpel blade and I'm going to soak it on both sides like this. So the site I have right here is this area we clipped here. So I'm going to pinch the skin here and so we can rotate him. And I'm going to scrape it down until I see the capillaries bleeding. So now that I got some capillaries bleeding here, I'm going to place the skin cells on the slide, and then I'm going to look under the microscope in a pattern that's like this to see what types of organisms I see. So I'll move here. Once I get it focused into 100 times power, I'm going to go in a pattern like this and evaluate the slide. So now that I finished looking at the entire slide, I'm going to put the results in the patient's record. We didn't see any organisms, so I'm just going to put no organisms found. And it's in there. This is task 19. I'm going to perform a cross match. So I have my two EDTA tubes here. So I have the donor, the recipient's blood here, it's clearly labeled, and then the donor's blood here. So I'm going to centrifuge it at 9,000 RPMs for 5 minutes. So I'm going to balance the centrifuge here, place them in, and then set the timer for 5 minutes. While that's waiting, I have my two plain top tubes that are marked donor and recipient to separate the plasma from the red blood cells. So my tubes have finished spinning, so I'm going to remove them here. And I'm going to do one at a time. So you can see that the plasma is on top of the tube, so it's just a little bit here. There's a little bit of hemolysis. So I'm going to make sure that the donor matches this tube. And what I'm going to do is I'm going to carefully separate the plasma and put the plasma in a tube. So the donor goes to the donor tube. So I have the plasma here. Then I'm going to do the exact same thing with the recipient. So I'll get a new pipette. And you can see the plasma here. So I'm going to make sure they match recipient with the recipient. And I'm going to get the plasma off here and place it in the tube here. Next thing I'm going to do is I'm going to wash the red blood cells. So what I'm going to do is I have already pulled up some saline, and I'm going to place a little bit of saline here in the tubes, and I'm going to centrifuge them, and then I'm going to remove the top part just like I did with the plasma, and I'm going to repeat that 3 times so that the red blood cells have been washed for a total of 3 times. So this is round 1. Okay, so this is the centrifuge just got done spinning for the 3rd time for the 3rd wash. So I'm going to remove the tubes, and since this is the saline here, so what I do is I'm going to remove the saline that I put here, and then I'm going to do the same with this tube and grab a different pipette so we don't contaminate anything. So this is the saline here. So again, this is the 3rd time that I've done this. Okay. So the next thing I do is I'm going to make a 5% solution. So what that is, it's 1 drop of red blood cells mixed with 20 drops of saline. So I'm going to get 2 more pipettes. It's lots of pipettes in this. So I'm going to, this is the recipient and this is the recipient cells. So I'm going to make sure that they match, and I'm just going to remove 1 drop of the blood here, and I'm just going to put 1 drop in the recipient cells. one drop here. So it kind of stuck at the bottom. Okay, then it's 20 drops of saline. So I have the saline here, and it's gonna be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18. There's 20 drops here. And I'm going to invert it like that so it's mixed. And I'm going to do the same thing with the donor. So 1 drop of the donor red blood cells. So put the 1 drop here. There you go, 1 drop. And then the 20 drops of the saline. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So I'm going to invert these. So now I have recipient cells, donor cells, then recipient plasma and donor plasma. And then I have my control here. So I'm going to put 2 parts plasma to 1 part of red blood cells. So I need 1 more, so I need 2 more tubes. So follow me here. And we'll get 2 more white top tubes. And I'm going to label 1 major and 1 minor. So for the major cross match, I need recipient plasma and donor cells. So recipient plasma, this one, and donor cells. So it's going to be 1 part donor cell and 2 parts plasma. So one part donor cell, so 1 drop. To 2 parts plasma. Donor cells, recipient cells. So recipient plasma. One, 2. So we have the major one here. Now for the minor, which is in this tube here, it's going to be the donor plasma and the recipient cells. So donor plasma, 2 parts donor plasma, one, 2, and then 1 part recipient cells. So recipient plasma, recipient cells are here, so I need to get another pipette. Oh, here's one right here. Thought I grabbed one. So just 1 drop of the recipient. There's 1 drop. So this is for the minor. Then I'm going to have a control, which is going to be the recipient plasma and the recipient cells. So 1 part recipient cells, so 1 drop of the recipient cells, to 2 parts of the recipient plasma for my control. So I have my samples here. So what I'm going to do is I'm going to incubate these for 15 minutes at room temperature, and then I'm going to look under the microscope.
Go.
So now that these tubes have incubated at room temperature for 15 minutes, I'm going to centrifuge them at 9,000 RPMs for 15 seconds. So I'm going to do the minor and then the major. That's just for 15 seconds. And then I'll do the control after, just so that I can balance. So I'm going to time for 15 seconds. So it's been 15 seconds. And I'm going to examine the superinate for hemolysis. So I actually see hemolysis on the major cross match and none on the minor. So what I'll do next is I will resuspend the cells and look for micro and macro agglutination. So the first one I'll do is the minor. I'll place one drop on here. And I will put the cover slip on it. And I will look under the microscope. So I'll zoom it in at a low power. So I don't see any agglutination. All the cells are nice and round and they're freely moving. There a couple of them are crenated, but they aren't agglutinated either. So that was for the minor one, and now I'm going to do the major one. So I will resuspend the major one. And then place a drop on the cover slip, on the slide, and then use the cover slip. And I'm going to do the same thing. So on the cross match, I see micro agglutination, where some of the red blood cells have kind of concaved with each other. kind of floating around, and I don't see a major agglutination, but I see a little bit of the micro agglutination, so this would not be a match for the dog. So then I would do the same thing with the control, just for comparison purposes. So here's the control.
No, I just have to count something. Oh, okay.
And
Just trying to be
I don't see any agglutination in the control here. So on the major cross match we saw micro agglutination. So now that I performed the cross match and I saw microagglutination, that's where the red blood cells are stacked. There wasn't very many of them, so it was kind of stretching it to do the microagglutination, but I'm going to record it anyway because I did see some. So I'm going to go in the patient's chart here, and I'm going to put, it's going to be in the major cross match. So major cross match, micro agglutination, and then for the minor cross match, no agglutination or hemolysis. And now that it's in the chart, I will report that to the doctor.